You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is Dr. David Gilbert. Dr. Gilbert, welcome to the program.
Thank you.
Okay, so this is, this is your topic, right?
It is.
Board certified in oral and maxillofacial surgery. I got that right, is that right?
Got it.
Okay, and what is that? I mean, what kind of a dental specialty is that?
It's a postgraduate residency training after dentistry that takes 4 to 6 years.
So 4 to 6 years after dental school.
Yeah, it's usually an in-hospital graduate program.
Okay.
And deals with all aspects of the mouth and facial surgery.
So you do the complex cases?
I do. It can vary from the simple tooth removal to full facial reconstruction and grafting if necessary.
So in your practice, you know, I look at your CV, you do a lot of things from TMJ to, you know, dental implants. I mean, what kind of patients do you see?
We see, on average, patients that come from other dentists referred to us, or patients walking through the door having heard about us, dealing with issues simply as removing bad teeth to replacing them with dental implants, which is a bigger part of our practice, and facial reconstruction.
Okay, now, you know, we talked on the phone and you talked how important customer service was. You said I'm a nutcase when it comes to customer service. Elaborate on that.
Well, it starts off with my expectations when I go for any type of service or product. Customer service is paramount to me, and I want to give my patients what I would expect myself.
Okay,
Yeah.
so what are the different categories of dental implant patients you see in your practice?
On average, we see 3 different types of patients. A single tooth patient who is missing a tooth or going to lose a tooth and simply wants a natural as possible replacement. The others would be people missing a number of teeth, maybe in one location or multiple locations in the mouth. And they know that they will probably lose more, so they want to choose an option that will give them as close to permanence as possible. And the last patient is essentially a patient who has lost all their teeth, has had an inadequate alternative or option for replacement.
The denture wear.
The denture wear.
Okay.
And looking for something that restores their quality of life. I mentioned 3 categories, but there is a fourth, and it stems from the patient who has been told by their general dentist or dental specialist that they're going to lose their teeth.
All of their teeth have to
All
come
of their
out.
teeth.
Okay.
And that's an ominous thing to hear for anyone. And these patients are procrastinators. They fear going to the dentist.
You say people hold on to their teeth too long. What do you mean by that?
Well, there are times that...
I mean, they're told they have to go, and then what happens? They do nothing?
That's true. What most people don't realize is that they're fighting a losing battle most of the times. And everyone wants to hold on to as long as they can, but they don't realize what a true disservice they're doing to themselves over time.
You say that when people, you know, are told their teeth have to go, that they become withdrawn.
They really do.
Their breath is bad, and...
Absolutely. These people become reclusive. I mean, they lose their self-esteem. I'll tell you, there's a lot of value to smiling. And
but you're a dentist, of course you're going to say that. You think it's important.
It plays a big part in a person's health and well-being. Most of these people do not smile. They live an essentially depressed life. They're unable to...
I mean, do they tell you that? Is that how you know this? I mean, they tell you?
Many of them do, but most of them, you sense it in their communication, in their somewhat introverted perspective.
Okay.
And these people are truly dental cripples. They're nutritionally challenged. They live a less than pleasant life. But these are the patients I really cherish seeing. These are the people that you make the biggest impact on their lives. They can have replacements that are as natural as possible, and it can be from 1 implant to all 6 implants, depending on their scenario.
So you're saying as little as 2 implants for a denture wear? You can
Yes.
give them something that snaps in and snaps out.
Yeah, you know, this really is one of the biggest impacts in terms of people who have lost their teeth, going to lose their teeth, or have worn dentures for an unknown period of time and not been able to function properly. this really makes their life a huge turnaround.
Okay, and there are less, I mean, bone grafting, things like that. I mean, there's less of that going on for the most part in the industry when it comes to dental implants?
Certainly. I mean, the more we've matured in this whole implant process, less is more. Minimally invasive surgery is truly the way to go.
So what is better? I mean, how much has changed in the last 10 years
Well,
with dental implants?
technology has allowed us to do a lot more with less.
Like what kind of technology?
Particularly imaging and computer-guided surgery. We can spend a fraction of the time in surgery because we've spent the time before surgery planning and getting tools that allow us to be less invasive and less traumatic on a patient.
You could do surgery on the computer before you do surgery.
Absolutely.
How?
Yes.
How are you able to do that?
Well, what we do, we get a scan, whether it be a CT scan or today we use things more commonly known as a cone beam scan, which is less radiation than you would have at a CT scan, but similar information. And we would take that information and receive a computer virtual model of the patient, and we can do the surgery on the computer. And then from that, get guides that will allow us to place the implant with little or no surgery, little or no cutting.
So you're able to do it without like opening a flap in some cases?
That's true. When we have these guides, we're very precise. We can place the implant in its optimum position with the most amount of bone and not have to make big incisions.
Okay, now how is it, researching this topic before, knowing you were going to come here, how is it that you're able to do it, what used to take like 8 months or 9 months, I guess that was the thought at the time for a dental implant to heal in the bone, that you're able to do it now in one day?
Well,
and they get a tooth on there.
Absolutely. Well, first of all, we know a little more about how things work and how they heal and what our bodies are able to handle. The other reason is that technology allows us to pre-plan their final teeth positions and teeth restorations so that we can have that ready before they have surgery. So on the day of surgery, they can have implants and place that restoration at the same time.
How soon can they eat after the surgery? I mean, ideally. In a perfect scenario.
In a perfect scenario, this is the very day, the minute they walk out of the office.
Are there patients that you have that, like denture wearers that come in, you give them dental implants and they're eating the next day?
Certainly, and this is really what makes it justifiable. To see a patient make such a huge turnaround within a couple hours of their visit with us is really rewarding.
When I see terms like no more dentures that get a fixed set of teeth in one appointment, is that possible for the denture wearer?
Very possible.
Is that an overstatement?
There are patients that will benefit from that service. There are others that may not necessarily be able to have that procedure. But on average, the average patient, like we discussed earlier, will be able to have implants placed with teeth on that appointment day.
Age ranges. I mean, how old can you be? Anticipating this interview, told my mother, I'm talking about dental implants today, and she said that she's too old for dental implants at 73. She's a denture wearer. She's 73 now. She's been a denture since she was 28. Is she too old?
Well, people chew and eat or need to eat all their lives, and age is really not a factor when it comes to nutrition.
But at her age, will they fall out? That's her impression.
No, they don't. We really do not know how old is too old. As far as we're concerned, every patient is a candidate.
So what are the upper ranges then of people that are out there that are getting dental implants?
80, 90 years of age.
Is that right?
Absolutely.
But why would somebody 80 or 90 want to go through the process of getting a dental implant?
Because they understand the value of teeth, and they know what that means to them. They know how hard it's been for them to enjoy a good meal, and most of their lives are centered around eating at that age.
Good point.
It's a big part of life, and it can't be discounted.
Let's back up for a moment. Okay, so one tooth, somebody missing one tooth. Help me understand the benefits of why you would want to get a dental implant over traditional dentistry.
Well, you really have to understand, first of all, what happens when you lose a tooth.
Okay.
When you have a tooth in the mouth, it supports the bone and the tissue around it. When you lose it, that bone and tissue goes away. There's no more function in that area. Additionally, the teeth adjacent to that or opposing that area drift into that space. So replacing teeth is a very big issue. If you were to look at some of the options for a single tooth.
So this chart, I mean, you show this to your patients?
We do.
Okay, so one tooth.
One tooth. Traditionally, people will get a removable appliance. This is an appliance that
Is that a
has
flipper? Is that what they call
a
those?
flipper or partial denture.
Okay.
It's got a single tooth on it, but it has a coverage over the palate and hooks onto other teeth to replace the missing tooth. It does nothing for the underlying bone, but prevents teeth from drifting and gives you a tooth in the area.
Okay.
The next step up, traditionally, would be the bridge, a dental bridge. It's fixed. It's a great way to go. The downsides to it, it does nothing for the bone and tissue, as we discussed before, but it also grinds down adjacent teeth. And it compromises those
So you
teeth.
have to damage the teeth on the side. Why? Oh, to hook it on.
Virtually, you
Okay.
have to compromise the teeth by grinding them down to create a crown for the adjacent teeth so that you can put a fake tooth in the middle. These are not considered permanent restorations. They do have a limited
Like a
lifespan.
patchwork? I mean, could somebody say that?
Well, I wouldn't consider it patchwork, but it certainly isn't considered a permanent restoration in today's world. An implant, on the other hand, supports the bone. It does not destroy or compromise adjacent teeth.
So it's much easier than just giving their tooth back. I mean, is that what you're doing in a way? It's like a tooth root?
Absolutely.
Okay.
What an implant really is simply a metal post to replace the previous tooth root.
Okay.
And
But it's made out of what? Titanium?
It's made out of titanium, and it's a near natural tooth replacement.
Okay. So I understand this correctly. Okay, so if there's a hole in somebody's mouth, the bone, they're starting to lose bone, does that make the other teeth collapse, cave in? Because you say there's a bit of a snowball effect
Absolutely.
that happens when you lose teeth.
I like to use the term domino effect.
Domino, okay.
Yeah, because as you lose one tooth, you compromise the adjacent teeth. And there is certainly a chance or possibility that with time and wear and disease, you lose the other teeth. And before you know it, you're at the point of considering dentures.
Okay, so would the experts agree nationwide? I mean, if you're missing one tooth, you should get a
Absolutely.
dental implant.
Absolutely. There's no question in my mind, if I were missing one tooth, that's what I want. And it is the gold standard.
A lot of people missing 3 and 4 teeth in the back that have, I guess, bridges or partials or whatever. And you said that you'd like to see more of those people.
Absolutely. I wish
But why is it important for them to go in? Because everything seems to be fine.
Well, I wish these people would see us sooner, because one of the biggest reasons we see these people is because their bridge or other tooth replacement option is failing them. And now they need some of the things that people don't want, more extensive surgery. The time for them to come in when they're missing teeth is early, before.
Well, how do they know if it's failing? I mean, it just starts getting loose?
Loose, bad breath, pain, tenderness, or some of them don't even realize it. This is where a regular visit to your dentist really matters. I'll show you a little bit of what I show patients and what you just talked about. Yeah, here is someone missing a number of teeth in the back, and using similar sort of alternatives, they can go with a partial denture, a bridge, and even an implant retained bridge. Take a look at this first model. They're missing teeth in the middle, and this area over time will atrophy,
So it resorbs?
or
I mean,
resorb and
okay.
shrink, and that essentially is the beginning of the domino effect. Then that compromises the adjacent teeth, and you lose more and more teeth.
So it's the pressure, I guess, so I'm understanding this, the fact that the dental implant's on the bone and they're eating, the pressure keeps the bone.
Absolutely, the
And
function.
by keeping the bone, it keeps the other teeth from collapsing.
Correct. You've restored what nature needs to retain that bone. And you've essentially rehabilitated a patient so they don't have to be like 10% of our population wearing dentures.
So on the internet, you know, they're saying 15, 20 million Americans have either an upper or lower denture. Do you think it starts there? That means, I mean, does it always start obviously with 2 or 3 teeth?
It's the beginning. People don't typically lose all the teeth in one shot. It starts here. They lose 1 or 2.
And so are you convinced that dental implants will stop that process?
I believe it certainly is the way to abort that process.
Okay, and the baby boomer crowd, they're out there, a lot of them fit in this scenario.
Absolutely.
And they're fine. You say, come in, get it taken out, get a dental implant. I mean,
Most of these people were exposed to a different type of dentistry in their growing years. So they are missing a number of teeth. And they just have not explored the options in today's world.
But is that what they should do? I mean,
Absolutely.
Okay.
Absolutely. We don't want them to end up like the rest of patients that are without teeth and wearing dentures. We want to be able to rehabilitate them so that they can have a natural replacement of their teeth.
We're going to take a quick break. We come back, more about denture wears and their options. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, what denture wearers need to know. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. Okay, Dr. Gilbert. Now, you're an oral maxillofacial surgeon. You're a specialist. Does somebody need a referral from their general dentist to see you?
They don't. They can simply talk to their dentist about implants. Their dentists know what implants are and why they should have them. But they can simply call us and we'll be happy to see them.
But isn't it more expensive to see a specialist that's doing dental implants rather than just going to a general dentist that does the surgery? And
It really isn't. Implants certainly have a price range, but it's very narrow. And seeing a specialist is really no more expensive than seeing a general practitioner. Obviously, I have a bias as a specialist. I believe that it's important for patients.
You're the surgeon. You're the oral surgeon.
Yes, I am. I think it's important that patients understand how to select their implant specialist. And certainly you want to go to see someone who has a focus on that specific part of dentistry and implant dentistry, and that's a large portion of our practice. You want to go to someone who does it daily.
You said at the break, you said that when things go wrong, they end up in your lap anyway.
They do, and that's one of the reasons patients should be careful about.
I mean, and we're talking about the work of another dentist. I mean, when things go wrong, they have to see the surgeon.
Well, as a specialist, we are the go-to people for the things that do go wrong. So it is important that if a patient were looking for a specific procedure, they go to someone who has the experience.
Okay, you know, it's funny. People always ask me for referrals. Randy, you know, who should I go to for this? Who should I go to for that? And the first thing I say is, go to a specialist. Look for somebody. If you're going to have your knee operated on, go to a specialist. It seems obvious to me, but I think in the world of dentistry, and correct me if I'm wrong, any general dentist can do dental implants.
Absolutely.
Right. Okay. So they could go to a specialist, and then you work together with their general dentist.
We work very much so hand in hand with their general dentist.
Okay.
Our practice is really about whole person care, and a lot of what we do is interdisciplinary, meaning we work with other specialists and general dentists in making sure that that patient gets the complete optimal care.
So moving over to the dentures, denture wears, what are their options?
Well, simply they can have 2 implants placed in the lower jaw, and using their existing denture with no added cost, simply clip that denture into place.
So you just make like fasteners in their denture?
Little snaps that go in and out to hold the denture in place. And we can take that to a point where the patient is completely unable to remove the denture, where it's fixed. It's like natural teeth. The dentist can't remove it if they have to.
How many implants for that, to give them something fixed?
As little as 4. On average, 4 to 6 implants will give a patient a complete dental rehabilitation.
And they can't eat right away if everything goes right?
They will be able to eat right away, chew what they would have if they had natural teeth, and be as comfortable and confident as they would have if they had natural teeth.
Okay, so 2 dental, do you think people count their teeth and think, oh my goodness, that's way too expensive? You're saying that though with 2 dental implants, you could give them something snap in, snap out. Is that going to be more, I mean, a lot more secure, do they tell you, than gluing it in the way they're doing
Absolutely.
it?
One of the biggest patient fulfillments is really being able to go from a denture that's loose to something that is secured. And 2 implants really, really make a night and day difference for someone. It is a life-changing event.
Do they tell you that? I mean,
They really do. They
just
really do.
getting their teeth back changed their lives?
Teeth, like I mentioned before, really are an important part of patients' self-esteem, confidence, specifically people in the limelight or in the public eye. It really can rehabilitate a patient's entire demeanor. And you see it in front of your eyes as we're able to give
So they
them
walk
these
in with
implants.
more confidence
Absolutely.
by getting their teeth back?
I'll tell you a patient that I saw last week. She ran over literally from her dentist's office to show me how her teeth looked. And the first thing she told me was, I gotta tell you, I actually smiled at a stranger. And
Is that right?
At face value, that sounds fairly simple, but she had not been smiling prior to that. And to be able to smile to a stranger was a big, big issue for her and a big deal. And you can see it on her face.
Can these look real, authentic? Because I always feel like I could spot dentures. I mean, do they look good?
In today's world, aesthetics is paramount. Everybody wants to be able to look real, look rejuvenated. And with today's dentures, today's tooth replacements, it is as natural as you would hope.
So as a recap, 2 dental implants, you could give them something, snap in,
Let me show you
snap out.
a little bit of this. Here's a model that shows a denture.
So that's like a lower denture.
Yes, but what holds it in place, and you can see how difficult it is to remove,
all right.
that there are 4 implants placed in the lower jaw. They can be as little as 2, but this one's connected by a bar, and there are clips on the inside of the denture that allow that to be fixated to the bar. Keeps the denture in. You can even take this to a point where there are more implants, or using the simple 4 implants, what we call all-on-4, we're able to fixate what we call a fixed bridge prosthesis on these implants so that it is not removable.
It sounds like, I mean, every denture would want something fixed, something that doesn't come out of the mouth.
Most patients come in wanting something that is as natural as possible, and they do not necessarily want something that clips in and out. While the clips are very, very good and certainly is a great replacement, the fixed option is certainly the most desirable.
Okay, but it sounds like it's very painful, though. I mean, drilling into the bone, putting these into the bone.
Well,
I mean, do they complain about it?
That is a misconception. Certainly, surgery is ominous to anyone. But like I mentioned, with technology, we're able to do more with less. For example, if we were to have a patient get a scan, we will get a model of the patient's skull or facial skeleton, and we're able to do the surgery on the computer, and a guide is made.
So that guide goes on their gums.
It goes on their gums. We're able to place the implants through tiny openings, not lifting up their gums, not making an incision, and with that, the recovery process is extremely shortened.
Like they go home. I mean, somebody can go home and what, take a couple of ibuprofen?
Yeah, the average patient will use a couple Advils or Tylenols after surgery like this. On average, a surgery like this in the past would have taken twice as long and taken twice as long for recovery.
When it's all said and done, they get the process. What do they say? I mean, do they say that? I mean, do they brag about that they can eat? I mean, what is it? What are they happiest about?
They're happy because they can do what they always wanted to do.
You smirk even when I ask you that question, because does it make you think of the patients, what they say?
Absolutely. It helps me reflect on what I see daily. And that is patients that are meeting their life's goals. They come in and they've always wanted to have teeth replacement. They've always been concerned about some of the compromises they've had to face. And now they are no longer faced with those challenges.
Is this one of those things where they say, "Doctor, I should have done this years ago"?
Absolutely. It's like summiting Everest. It just truly is that fulfilling.
But pain, is pain the #1 fear? I mean, that's what you hear. I mean, on a consult, are they always worried about pain?
Well, I think the biggest issue for patients is that it's always the fear of the unknown. People don't do surgery every day. And that's one of the reasons they see us. They come in because they want to do this as pain-free as possible. And we're able to do this whether it's just under a little local anesthesia or fully asleep.
So the procedure itself, because it seems like going into the bone is very painful.
While it seems,
Obviously, they're numb. They don't feel it.
it really seems that way, but the bone really has a lot less nerve endings than does the gums. And certainly when you do surgery and you have to do less incisions in the gum, the recovery and the pain perception is a lot less.
So within the next day, they're eating again.
Absolutely. Patients are able to resume a fairly normal life after surgery.
If it's as good as you say it is, for the denture wear, why aren't they all doing it? 15 million people have dentures. Why aren't they all running in for dental implants?
Well, people typically need dentists when they have teeth. And when they no longer have teeth, they have dentures that they're able to maintain on their own. And as things get a little tougher, they use glue and more of it as time goes by. So on average, the patient does not get the exposure to the dentist.
So nobody is suggesting it to them?
They're not getting the exposure.
All right, so they don't know their options, and of course their fear of pain. So we've talked a lot about the lower denture. I mean, the upper denture, same thing.
Essentially, but it's even a bigger impact on the patient, because the average patient having an upper denture has coverage or plastic that covers the roof of their mouth. And that really compromises their taste, perception, and speech. And being able to get rid of that palatal coverage or removing that covering over the roof of their mouth is a huge impact on their perception and their comfort.
So would you say that there's not a happy denture wearer out there? Because I never heard denture wearers saying, this is terrible. I know denture wearers.
Well, denture wearers typically don't share their misery with people, but this is something we hear every day, and these are the issues we face when patients walk into our office. These patients truly are in need of a change.
So getting started.
Well, what you really need to do is just basically come in for an appointment. Everyone has a different situation. Everyone requires a little different workup. And what we need to do is basically see what your needs are and the best way to accomplish them. Some patients may be able to get their teeth in a day, while others may take a little longer. But what it starts with is an appointment.
So you're not too old. I mean, people like my mother that self-diagnose and say, oh, Randy, I can't get dental implants, I'm too old.
They all need teeth, Randy, and certainly they all want to chew and they all want to
But 90-year-olds are getting dental implants and they're staying in there.
They do, and that's the beauty of what implants do for people. They are able to make life changes throughout the age spectrum.
So final message?
Well, anyone missing teeth, you can do something about it, and you can get as natural a tooth replacement as you've always wanted.
I want to thank you for coming on the show. Very interesting.
Thank you, Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.